We'll get you to today's top stories with the exciting news a few weeks back that the COVID vaccine was beginning to be administered here in Idaho. Came a question from many of you: when will it be my turn to get it? We know that healthcare workers and those in long-term care facilities were the first priority, but where do we go from here? The answer, of course, will vary from state to state, but we now have a much clearer picture of what that will look like here in Idaho. Our Joe Paris joins us to explain the new timeline from the Idaho Department of Health and Welfare. Joe.
Well, Kim, to simplify it, earlier, the Idaho Department of Health and Welfare, they actually posted a graphic to the state's COVID resources page, and we'll show it to you in a minute. It really just lays out the specific groups and the timeline of when the vaccine will be available to them. And as this graphic was really shared across social media, there was a lot of questions and people pointing to different groups and wondering how exact this is. So I sat down with Idaho State epidemiologist Dr. Christine Hahn. She and I worked through this timeline. We'll give you a look now at what she had to say about it. This chart is an early projection for when Idahoans and select groups will be able to get their COVID-19 vaccine. The timeline, published by the Idaho Department of Health and Welfare, is split up into 4 different waves spanning from now until May 2021, when public health officials hope enough vaccine is available for the general public.
This is definitely not set in stone. This is our plan for right now, but this can change.
State epidemiologist Dr. Christine Hahn is a part of the team that worked to navigate federal and state guidance for when people will be able to get a COVID vaccine. Balancing things like CDC guidance and Idahoans' own preference led to this preliminary timeline estimate.
We thought it would be really helpful to have this vaccine timeline. It's an estimate. We can't predict what's going to happen. We've already heard in the last few weeks how sometimes we think we're getting a certain amount of vaccine and then we get less than we thought. But this is our attempt to illustrate for everybody when they can get the vaccine.
With that said, this timeline should not be treated as the end-all be-all schedule. Here's what the projections entail. We're currently in Wave 1, which has an emphasis on healthcare workers and those in long-term care facilities. With the early vaccine availability, right now the focus is still on frontline healthcare workers, as well as those in places like senior living centers. Soon, though, Phase 1 will expand to other medical fronts, like all outpatient clinic staff, pharmacists, and emergency medical service workers, just to name a few. And Phase 2 includes groups like K-12 school staff, grocery and convenience store workers, firefighters, police officers, as well as those in the general population aged 75 years and older. If people in Phase 2 will be able to start getting vaccines as early as February. If that includes you, you may be wondering about the specifics of figuring out when and how to get a vaccine. And Dr. Hahn says those details will be tailored as we approach Wave 2.
That's all coming. We know that we wish we had more time to be ready ahead of time. We are sort of building this plane as we fly it, but we are really hoping that shortly we'll have a much better information for people on where to sign up or where to get their vaccine.
Very generally, Hahn says that the idea is for local health districts to work with employers to arrange where and when their employees can get vaccinated as specific waves near close.
We want to make it as easy as possible, so we're trying to get some really nice easy ways for people to get notified when they're able to get vaccinated.
Phases 3 and 4 really open up, with 3 including everyone 65 and older, as well as people aged 16 to 64 who have medical conditions that could increase their risk for a severe case of COVID. Phase 3 is set to begin in April. The 4th and final phase for the general public is slated to begin in May. Now, it's important to note, though, there are many factors that could alter this timeline. For example, if not enough vaccine is sent to Idaho, then a group could be pushed back a wave. Conversely, though, good news could speed a group up.
Let's say another vaccine gets approved in the United States and we get a 3rd vaccine. That could speed the line up. So it could go that way as well.
The bottom line here, this timeline is, again, a preliminary projection. Specific details about when and where groups are in different waves and when they can get their COVID vaccine, still to come.
I really hope that people find this helpful, but please don't see it as set in stone. It's absolutely a living document that we're going to keep changing as our advisory committee makes more decisions and also as we get more information about how much vaccine we'll be getting.
So I know it can be difficult, but it's going to take a little bit more patience to get all the specific details lined up. Again, right now, the emphasis is getting all of those frontline healthcare workers vaccinated, as well as those in those long-term care facilities. And Kim, I know our viewers might have seen some of these resources online, some tools that you could plug in information onto a website. There are all kinds of these websites. We'll try to give you a guess on where your spot in line is for the COVID vaccine. Dr. Hahn says she understands the excitement of trying to figure that out, but she says those resources really aren't that valuable in terms of the specifics here in Idaho. Everything changes from state to state, so she would refer you to that chart. And again, patience is key here. They're working as hard as they can to get the details out as they become available.
Joe, you know what my mama always used to say, always still says, patience is a virtue.